unfortunately, traditional orthopedic medicine only has drugs and surgery as two primary tools. So it's symptom-based until that doesn't work anymore, allows conditions to get really bad over time until they reach end stage, until we're able to use the next available tool, which is typically radical surgical intervention. The largest demographic of patients that we see for joint-related issues, it takes them years and a lot of failed attempts to finally reach out and try to find alternative solutions, right? And the reason that they usually reach out is because now the pain has gotten so significant that they can't function in their daily life. Nothing else is working. They've been told they need a replacement surgery, and they're scared to death of that. At that point, that's usually the indicator, or that's usually the time at which they decide to look for other solutions. We talked a little bit about getting to conditions early so that we can prevent the need for that level of disability and pain and discomfort for extended periods of time. There's no quality of life in that. I talk quite a bit about what I call the gap in orthopedic injury care. Unfortunately, traditional orthopedic medicine only has drugs and surgery as two primary tools. So it's symptom-based until that doesn't work anymore, allows conditions to get really bad over time until they reach end stage, until we're able to use the next available tool, which is typically radical surgical intervention, right? And I'm not opposed to surgery. I mean, we've made great advances in replacement surgery on many levels, but at the end of the day, it does come with significant risks and it doesn't always work, right? But more importantly, we've spent, 10, 15 years of our life not being able to do the things we love and enjoy. Now, more and more, because there's lots of information out there and people have access to influencers and other people, more and more people are getting more information about how to solve problems in a regenerative environment so that they can actually recover from injuries, keep their body healthy so they can continue to function. I mean, we see professional athletes every day more and more talking about regenerative medicine at this point, and there's a reason that they resonate with it. It's because they want to continue to use their body. That's their tool and their mechanism by which they can support their families. So they obviously want to recover from injuries, and they want to recover stronger, and they want to continue to play sports. And I think that is something that everybody should have access to, right? Because whether you're hitting home runs for the New York Yankees or you need to go to work tomorrow to support your family, it doesn't really matter. You deserve the same level of healthcare. If this is something you've been thinking about, take a second to reflect, because awareness is the first step toward change. What do you think about this?